How to prevent and treat migraine attack. Migraine is the most common cause of headache affecting both men and women. Women are 3 times more likely to have migraine than men. In 90% of time, migraine starts before 40 years of age. It can cause severe throbbing pain or a pulsing sensation, usually on one side of the head. And it often associated with 1. Nausea, 2. Vomiting, 3. Extreme sensory sensitivity such as to light, sound or movement. It can be either occasional inconvenient attack or frequent headaches severely impacting on quality of life. It may transform into chronic daily headache as well. Migraine can become with an aura or without an aura. Approximately 20% of people experience a warning symptom known as an aura, occurs before or with the headache. Aura can include visual disturbance such as flashes of light or blind spot, or other disturbance such as tingling on the one side of the face or in an arm or leg, and difficulty in speaking. Aura usually evolves over 5 to 20 minutes. Visual aura is the most common type. Migraine usually lasts from 4 to 72 hours if untreated. How often migraine occur varies from person to person. Though migraine causes are not fully understood, genetic and environmental factors appear to play a role. There are a number of migraine triggers. We should aware of these stuffs. 1. Stress. Stress at work or home can cause migraine. 2. Sleep changes. Missing sleep or getting too much sleep can trigger migraine. 3. Hormonal factors for women. Changes in estrogen levels seem to trigger headache in many women. If it affects before or during menstrual period, it is called menstrual migraine. It can also affect during pregnancy and after menopause. 4. Physical factors. Intense physical exertion including sexual activity might provoke migraine. 5. Diet. Aged cheeses, salty and processed food and skipping meals might trigger migraine. 6. Sensory stimuli. Bright lights and loud sounds can induce migraine. 7. Oral contraceptive pills and vasodilators such as nitroglycerin can aggravate migraine. There are no cure for migraine yet. But medication can help prevent and stop them or keep your symptoms from getting worse. Avoidance of triggers and lifestyle modifications like easing stress and having good sleep habits will help you. When you are having acute migraine attack, taking mild analgesic like paracetamol or an NSAID are often effective. And also you can take an antiemetic such as metoclopramide if necessary. When simple analgesic are insufficient, you can take triptans group of drug which are now available with various routes of administration. When you are having chronic migraine, you can have migraine suppressant medication with an advice of your physician. Whatever the medication you are using, you should be aware that repeated use of analgesic leads to further headache, known as medication overuse headache.